All right, let's just dive right in. If you've ever felt a little, lost or unsure about the exact steps, the timing, or the real techniques for a breast self-exam, you are absolutely not alone. Let's be real. Clinical instructions can often feel super sterile, overly medical, and honestly just hard to translate into a practical, everyday routine. But in this explainer, we're going to change all of that. We're breaking down the exact how and when of breast awareness, and we're going to equip you with the precise, hands-on methods you need to perform a confident and thorough self-examination.
So here's a quick look at what we're covering today. 1. Timing and hormonal science. 2. Multidimensional visual inspection. 3. The triple pressure method. 4. Evidence-based focus areas. And 5. The reassurance workflow.
All right, starting with Section 1, Timing and Hormonal Science, grounding the routine in science.
Okay, so the absolute most crucial point when it comes to timing is this specific window right here, exactly 3 to 5 days after your period. And I really want to emphasize this. These numbers are absolutely essential. This specific time frame isn't just a suggestion, it's the medical gold standard for accuracy. Because think about it, if you try to perform a self-exam right before or even during your period, the natural, fluctuating state of your breast tissue is going to make it incredibly difficult to get a clear, accurate baseline.
You see, during your cycle, your regular fluctuation of hormones causes real physical changes in your breast tissue, often making things feel tender, lumpy, or swollen. But by waiting until exactly 3 to 5 days after your period ends, those hormone levels finally drop and stabilize. The swelling naturally just goes down. It's in this exact window that your tissue is at its most natural baseline state. And what does that mean for you? It means any actual anomalies are going to stand out so much more clearly against your normal tissue texture.
Moving right along to Section 2, Multidimensional Visual Inspection, moving from looking to feeling.
So when you're standing in front of the mirror, there are 3 distinct positions you really need to follow to make sure you're capturing every single contour and angle. Step 1. You just stand with your arms relaxed at your sides, keeping an eye out for any obvious changes in size, shape, or skin texture. Then, Step 2. You press your hands firmly onto your hips. And finally, Step 3. You raise both arms high above your head.
Now, you might be wondering, why these specific poses? Well, by moving through these 3 distinct positions, you're actively flexing different chest muscles, which makes any potential changes in shape incredibly visible. Like when you press your hands on your hips in Step 2, you are actively contracting your pectoral muscles. If there happens to be a tethering or a lump pulling on the tissue right beneath the skin, flexing that underlying muscle will often make a dimple or a pucker suddenly pop up on the surface. By deliberately shifting through these stances, you're dynamically changing the tension in your chest. It gives you a comprehensive, multidimensional view that a single static pose just literally cannot provide.
Now for Section 3, the triple pressure method, a tactile scale for precision.
Okay, this is where we actually get hands-on. To apply this method, you need to check the tissue 3 distinct times using 3 different levels of pressure. Using the pads of your 3 middle fingers. You don't just feel an area once and move on. You feel it 3 separate times in small, overlapping circular motions. First, you use light pressure, just enough to move the skin without sinking into the tissue, to check the surface. Then you step it up to medium pressure to investigate the mid-level tissue. And finally, you use firm pressure, pressing down until you can actually feel your ribs, to thoroughly check the deeper chest wall. This layered, meticulous approach guarantees that absolutely nothing is hiding beneath a quick, superficial sweep.
Let's look at Section 4, Evidence-Based Focus Areas, where to prioritize your attention.
While you absolutely 100% must check your entire breast and the armpit area, the science actually tells us that not all zones are statistically equal when it comes to findings. Statistically speaking, the upper outer quadrant is the most frequent area for finding lumps or changes. If you imagine the breast divided into a grid of 4 squares, this upper outer quadrant is the section closest to your armpit. The numbers really speak for themselves here, reinforcing just how much of a hotspot this particular zone is compared to the rest of the tissue.
Because of this data, when you're going through your routine, you need to be exceptionally thorough in this upper outer area that extends up toward the armpit. This is where a significant percentage of your glandular tissue actually lives. When you're applying that triple pressure method we just talked about, slow down here. Seriously, take your time, be meticulous. Make sure you're thoroughly examining from the collarbone all the way down and sweeping entirely into the underarm area where those important lymph nodes and extra breast tissues are concentrated.
And finally, Section 5, the reassurance workflow. What to do next?
Let's pause for a second, because finding a lump or a sudden change in texture can instantly send your heart racing. It is completely, totally normal to panic in that moment, but having a calm, professional protocol already in place can really ground you. Our immediate human reaction is anxiety, for sure, but preparing yourself mentally right now for what to do next removes the fear of the unknown and puts the control right back into your hands.
By following a simple, logical process, you instantly have an actionable, step-by-step game plan rather than just being left in a state of panic. Step 1 is simply to stay calm and observe. Remind yourself that the vast majority of changes are benign and often just hormone-related. Step 2 is to clearly note the details. Exactly where is it located? Does it hurt? And, crucially, are you still within that 3 to 5 day post-period window? And Step 3, the most important one, consult a healthcare professional. You don't have to be the one to diagnose yourself. You just have to notice the change and pass the baton to a doctor. This structured workflow takes a really scary moment and transforms it into a manageable series of practical actions.
So now that we've broken down this vital awareness routine, how much more confident do you feel? We've moved away from vague medical advice to a highly structured, scientifically timed, and practically tactile process. From understanding the hormonal science of why we wait 3 to 5 days, to actively capturing every single angle in the mirror, to applying the triple pressure method and prioritizing that crucial upper-outer quadrant, you are now fully equipped. So here's my final question to you. Now that you have this clear step-by-step blueprint, what day are you going to mark on your calendar to start your own routine?